When I was in my third trimester of pregnancy with Myles, we found out through ultrasound that Myles has hydrocephalus, so water on the brain. And then at that point, they referred us down to the University of Iowa for further testing. After a couple of weeks of testing, they were able to see that he has Spina Bifida. It was very devastating to find out that Myles was going to be sick. And you know, my first question was, is he going to be okay? Is he going to make it through this? I hadn't heard of Spina Bifida before. At that point, then we met with the neurosurgery department, Dr. Menisa specifically, and talked about a medical plan for after he was born. And the plan was to repair his spine and place a shunt for the hydrocephalus and go from there. His hydrocephalus was pretty severe. So within, I think, 3 or 4 days after birth, they went in to place the shunt. And then they did the spine repair at that time.
We covered the spinal cord, reconstructed the spinal cord, brought in muscle where there was no muscle to give coverage there, and converted the skin into a big flap so that way he had good coverage over the spinal cord.
And then when Myles was 4, his appendix ruptured, so that had to be removed. Because of the risk of infection, his shunt had to be externalized for 4 weeks while he was on antibiotics and clearing up any infection. Once again, Dr. Menisa, you know, just really always seems to know what to do and the best move to make.
Myles is a great guy. He's come through a lot. He's 13 years old now, and he's done much more than what I thought he would.
When we look back at what Myles has been through, it's really shocking to see him now doing so well. He walks very well, he's very active and very happy, social person. You know, we just feel like it's a miracle that he's doing so well. We feel very lucky. Myles has spent a lot of time at the UI Children's Hospital, and every time he has to come in, I know that we're in the absolute best hands. From the specialists that he has access to, the nurses, they become part of our family. We see them, you know, day in and day out, and not only do they, you know, take care of Myles' medical needs, but they, you know, make sure that he's happy and entertained, and you don't even realize sometimes that you're in a medical setting and that he's got tubes and wires, you know, sticking out all over because he's having such a fun time.
I think he likes it here more than he likes it at home. All the attention he gets.
To the doctors and nurses at UI Children's Hospital, we just would like to say thank you. You know, Myles has thrown a lot of curveballs at us, and we haven't always known what to expect, and every step of the way, you know, the right person has always been there and the right staff to make the medical decisions that he's needed and to take care of, you know, whatever issues have come up for him. And we're just so thankful that we have our Myles here today and the healthy condition that he's in and happy condition he's in. So thank you from the bottom of our heart.